bred the portfolio. So that's why we've taken the approach that we have to make sure that we have a good spread of the vaccines. And as today's news demonstrates, we keep buying. This process isn't over. We keep buying. I just want to correct you, JVT. You said we've got 350 million. We've now got 355 million on order. Over to you for the second question.
Yes. So on your question was specifically about the AstraZeneca Oxford vaccine, and whether any vaccine is going to work is simply unknowable until the data have been looked at, and nobody's looked at the data at this point in time. It is the same for all of the vaccines still in phase 3 that have not read out. Nevertheless, pretty much all of the vaccines around the world that are in development are targeting the coronavirus spike protein, as the Pfizer-BioNTech vaccine has done, as the Moderna vaccine has done. This really does begin to show us that the spike protein is a completely plausible and effective target for vaccines to be working against. And, you know, when we started this journey back in February, March, we didn't even know that. So, yes, we are, we're feeling in a happier place than we were. But do we know the data? No, we don't.
We're not there yet. Thanks very much, Thomas. Catherine Jones from Channel 5.
Secretary of State, thank you. You said in response to Divya's question about the end of the England so-called lockdown that it was too early to see in the data whether additional measures would be needed. But the SAGE subgroup, SPI-M, has reported to you that England returning to just 3 tiers on December the 2nd does risk the R value rising again and would undo potentially any decline in numbers that you do begin to see. With hospitals already under intense pressure, this could really put strain on them come mid-December. And so I'm wondering what measures post-December the 2nd you are arguing for within government on behalf of the NHS and all its staff to avoid a winter of really unparalleled difficulty for them.
Well, that's not quite what SAGE says, and it's well worth going and reading their precise advice because it's not about whether there's a tier system, but it's also about what measures are in each tier. But maybe Susan Hopkins would be better placed to set out the scientific advice on this.
So I think we have recognised that the tiering of the country has had a different effect in each area. Tier 3, and especially Tier 3 plus in the north, has had an effect in reducing the numbers of cases in the northwest, and we can see the northwest declining number of cases now. Tier 2 seems to hold in some areas and not so well in others, and so really it depends on how fast transmission's occurring and how well the individuals in the population are taking that advice in. We see very little effect from Tier 1, and I think when we look at what tiers may be there in the future, we will have to think about strengthening them in order to get us through the winter months until the vaccine's available for everyone.
Thanks very much, Catherine. Gordon Rayner from The Telegraph. Gordon.
Thank you, Secretary of State. Can I just ask, the Prime Minister has told us that he is bursting with antibodies, having had coronavirus, and yet he is still having to self-isolate for 14 days. We know the government is considering bringing in a 5-day quarantine period now, if you have a test after 5 days. Is it not time to rethink the whole policy of self-isolating for 14 days? And just secondly, you said earlier today that you can't rule out mandatory vaccinations. I know you're not planning it. Have you had discussions perhaps about people in certain jobs not being able to go to those jobs, such as nursing, if they haven't had a vaccine once one becomes available?
We haven't had any of those such discussions. On the first question, of course, we always keep under review the clinical advice of what how we can keep this virus under control whilst minimising the impact on people's lives. And, you know, the Prime Minister going into self-isolation is an absolutely clear demonstration that everybody, no matter who you are, needs to follow the rules. If you're asked by NHS Test and Trace to self-isolate, that it is absolutely vital that you do. And the Prime Minister is demonstrating that through his personal leadership in following those rules. So, of course, we keep those things under review, but we're not at a stage to be able to make any changes yet. Sean Linton from The Independent.
Secretary of State, thank you very much. Throughout the pandemic, The Independent has spoken to frontline NHS staff. Many of them report being exhausted. They are broken. Now, with cases rising, they're facing a bleak winter with widespread staff shortages and morale at rock bottom. But over the past 10 years, most have suffered real terms pay cuts. And you were filmed numerous times clapping for carers earlier in the year. Can you commit today to giving NHS staff a meaningful above inflation pay rise to help boost recruitment and most of all to help make patients safer on wards?
Well, thank you, Sean. As you know, we have an independent pay review process, and we've concluded a 3-year agreement with nurses. In fact, we've just concluded a long-term agreement with junior doctors as well. So though you tempt me, I'm not going to prejudge the outcomes of the independent pay review process. Finally, Jamie Kafash from Pulse magazine.
Secretary of State, during the election, you acknowledged we needed 6,000 new GPs. Since then, the number of full-time equivalent, fully trained GPs has decreased. GPs are doing more consultations than ever and are carrying out the biggest flu vaccine programme ever. So can you reassure patients and GPs that you will reduce their non-urgent workload to free up time for them to carry out the COVID vaccination programme while ensuring patients can continue to access the urgent care they need?
Well, this is an incredibly important question, and I'm going to ask JVT to comment as part of the vaccines rollout and with his clinical background. But what I'd say to every GP is how grateful I am for the work that you're doing and your whole practice, everybody in primary care, both on the flu vaccine right now, which is being rolled out in record numbers, and we've had a record uptake. We've had a 10 percentage point increase on the normal uptake of flu vaccines, and that's really good news. And, of course, on the normal pressures of primary care. I'm really glad that a much bigger proportion of appointments in primary care are now done either over the phone or by video, because that makes life easier for GPs and for patients, and there's been a really positive response to that. But that doesn't, of course, lift the whole burden, even though it makes access easier. And, of course, we've got hopefully a COVID vaccination programme ready to go. And I've asked the NHS to be ready to roll that out from the 1st of December. That's the first possible date it could be ready. That isn't my central expectation at all, but we do need to be ready for them because that is theoretically the earliest this could possibly be. The bulk of the rollout is likely to be in the new year if a vaccine, one of the 2 early vaccines, comes through, and that's the Pfizer vaccine, the AstraZeneca vaccine. We must be ready, and I want to thank in advance GPs for all the work that I know that they're doing now, and that there'll be even more of this winter to keep people safe. And on the clinical aspects, if I can hand over to JBT.
Yes, I mean, clearly the COVID vaccine programme, as soon as we have authorised vaccines and quantities at scale, is going to be the biggest and the most important thing the NHS has done for a very long while. And primary care are front and centre stage in all of the immunisation programmes that the NHS has ever delivered and will continue to be so. I do understand the workload pressures, but I do also think that it will be incumbent upon every one of us to put in extraordinary efforts to make this programme move as fast as we can, consistent with the available supplies and with the highest uptake we can possibly manage. This is a big opportunity to change the way the pandemic will roll out over 2021. It isn't going to produce an overnight result. It isn't going to affect the second wave that we're now in. but it could very dramatically change what the late spring and the summer start to look like. The precise bounds on that are unknown, but that's how big the prize is, and therefore it's really important that everyone pushes so hard on this. Not just the workforce, but also the public in terms of coming forwards for the vaccine, and as I said at the other press conference, being ready when you're called.
Thank you very much, JVT. I'd just say one more thing, because it's such an important subject, this. I know the pressures that the COVID vaccine rollout will put onto people across the NHS. It isn't just GPs, although GPs and the teams around primary care, the primary care nurses and the pharmacists will play an important role. It's right across the NHS. There will be work to do to get this vaccine rolled out. And I also know that there's a number of uncertainties which make planning harder, but it doesn't make planning impossible. And so it's critical that we get all that lined up so that we're ready to go from the start of December. And I want to thank in advance everybody who's involved in the NHS and more broadly in the rollout of the vaccine. It's going to be a big job. Thanks very much indeed to everybody. This ends the Downing Street Coronavirus Daily Briefing. Thank you.